Hi there. My name is Natasha.
My name is Imad.
And I'm Sierra.
We're a group of students studying at McMaster University. Throughout this semester, we've been learning a lot about multiple sclerosis and would like to share what we've learned with you. Whether you know or are someone affected by MS or are just curious, welcome to MS Basics.
It may feel like multiple sclerosis is at war against your body. When you are at war, you must protect your fortress, have weapons, and have enough soldiers to fight. In this case, the fortress is your body, and you must upgrade your defenses to ensure your fortress doesn't fall. To upgrade your defenses, you need to strengthen your body, which is accomplished by changing your exercise routine and diet. These lifestyle changes can help decrease both mental and physical symptoms. Not every war is the same, and therefore the weapons you will need depend on the battles you are fighting. Assistive devices have been made to help manage multiple sclerosis symptoms, and these are your weapons. Lastly, you need to ensure your soldiers are protected so they can fight for you. The soldiers of the body are yourselves. To help them, a few drugs have been made to help them survive and fight against multiple sclerosis. It is important to talk to your doctor or physical therapist to help you better understand your symptoms and get you the best possible routine. First, let's look at how exercise can help. Common symptoms such as balance issues, fatigue, and low mood have been shown to improve through exercising regularly. Also, exercise can help by improving your aerobic and muscular fitness, your heart, bone density, and immune system, which are affected by multiple sclerosis. Some basic activities that can count as exercise are gardening, doing chores, cooking, or other activities that involve movement. Similarly, some recreational activities include Pilates, walking, yoga, and Tai Chi, among many others. However, for a specific routine related to your symptoms, it would be best to get advice from your doctor or physical therapist. Also, it is important to report any issues to your doctor that occur while exercising. This is because if you overexert yourself, it could lead to flare-ups. Vigorous exercise can cause severe fatigue and increase your risk of injury, which can worsen symptoms since it stresses your body. Dietary changes can also help decrease the severity of symptoms and lead to similar results found in those who exercise. Diet changes can help reduce the progression of symptoms such as inflammation, weakening of bone, and fatigue. In general, there is no best diet, but simple changes include eating more whole grains, fruits, and veggies, and lowering your sugar and processed food intake to promote overall wellness. If recommended by a doctor, it could be important to take supplemental vitamins and minerals, such as calcium and vitamin D, to improve your gut as this can boost your immune system, reduce fatigue, and fight the weakening of the bone. Aside from lifestyle changes, there are ways to improve your quality of life by acquiring assistive devices. Multiple sclerosis affects every individual differently, and the devices some might need depends on the symptoms they're affected by. If the disease affects your movement or balance, maybe using walkers, canes, crutches, or wheelchairs will help. Similarly, if you like to cook, some devices that can make it easier are rocket knives, lightweight equipment, electric can or jar openers, and much more. Despite the possibility of having symptoms that can affect daily activities you're used to, there are many devices invented that can improve your quality of life.
Although there is no known cure for MS, doctors might prescribe some drugs in an attempt to reduce the frequency of relapses and minimize the short-term illnesses that you might experience during a relapse. These drugs are known as disease-modifying therapies, or DMTs for short. Since the discovery of the first DMT back in 1993, there has been a lot of progress made in improving the effectiveness of each treatment and the way studies are done to prove it. DMTs are now able to fight off the cells in your body that are causing the destruction of your protective myelin sheath and can block signaling pathways, which essentially prevents communication between immune cells. There are also many different ways these drugs can enter your body, as they can be swallowed as a pill, injected with a needle, or administered through an IV. Although DMTs might target different regions, they all work with a very common goal in mind: reducing the inflammatory immune response. It is also important to manage other diseases along with MS, which you might hear being called comorbidities. This may include taking medication to lower high blood pressure, reduce heart disease, diabetes, or other general health conditions. Along with physical comorbidities, it is actually quite common for those with MS to experience higher rates of psychiatric disorders, which include depression and anxiety. These might also be managed through the use of medications, such as SSRIs or therapy. If you are ever experiencing any of these thoughts, don't worry, you definitely aren't alone. Don't be afraid to reach out to your doctor and find ways they can help. Improving your mental, physical, and emotional health is the best way to manage MS symptoms. We hope you enjoyed this video. Feel free to check out the other videos in our MS Basics series linked above.